Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad, este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Excelente, porque nos está brindando muchos conocimientos.
La verdad este curso me sirvió de harto, una capacitación excelente.
Es todo práctico, se aprende mucho.
Desearles lo mejor, que sigan adelante y que sigan capacitando a los profesionales de todo Tarija.
VirtuallCorp, acompañando tu desarrollo profesional. VirtuallCorp es una institución dedicada al desarrollo profesional, con más de 5 años en el mercado nacional e internacional. Nuestros cursos prácticos te acercan a la vida real de los puestos de trabajo, llevando la teoría a la práctica real. Aprende con nosotros con más de 100 formaciones disponibles para ti.
Buenas tardes nuevamente a todos los participantes de este seminario relacionado con el área médica. Bienvenidos nuevamente, mi nombre es Rubén Hernani y bueno, pues el día de ayer, el día de hoy estamos con este seminario. Primero que nada, indicarles que a todos aquellos que están ya participando, no se olviden de comunicarse con los números que están en pantalla, tanto en YouTube para poder recibir sus certificados o cualquier duda o consulta acerca del curso, quizá quisieran el material, también pueden obtenerlo, ¿ok? Simplemente pueden pedirlo, no se olviden hacer todo esto para que puedan recibir sus certificados. Bueno, ustedes ya me conocen, mi nombre es Rubén Hernani y bueno, voy a volver a darles un poquito acerca de mi experiencia laboral. Estamos hace más de 19 años trabajando en el área del idioma inglés. Hemos trabajado en bastantes instituciones, tanto colegios como instituciones privadas relacionadas a la enseñanza del idioma inglés, en las cuales he fungido como profesor de inglés, también como coordinador académico, obviamente de la ciudad, aquí en La Paz, Bolivia. Sé que el seminario es internacional, entonces estoy en La Paz, Bolivia. También he estado como coordinador académico nacional eh, en toda Bolivia, en todo el país. He estado trabajando en varias ciudades, entre ellas La Paz, Cochabamba, Oruro, Sucre, Tarija. Entonces, en este punto de vista yo tengo bastante experiencia en el área del inglés. También he estado trabajando junto a otra institución como director académico del área de inglés. Y bueno, pues todo esto me ha dado la posibilidad de poder ampliar los conocimientos y poder continuar eh, ahora con los seminarios que estamos impartiendo en el área de inglés. Bueno, en este caso estamos haciendo un seminario relacionado con el área médica, ¿no? Y bueno, pues vamos a continuar con lo que habíamos hecho anteriormente. Vamos a hacer un pequeño repaso para que podamos ponernos al tanto para todos aquellos que ya hayan ingresado y que no lo han hecho ayer. Vamos a poner un pequeño al tanto, nos va a tomar unos 10 minutos nada más para que podamos ver cómo estamos y luego continuar, ¿ok? El día de ayer habíamos trabajado todo desde YouTube y habíamos hecho bastante participación, lo cual me dejó muy halagado. Y el día de hoy ahora vamos a trabajar directamente con Zoom participando. ¿Para qué? Para que podamos interactuar tanto mediante el chat, así también como hablando, ¿ok? Ese es el motivo por el cual ahora vamos a trabajar en Zoom. Primero que nada, pedirles muy respetuosamente que si bien tienen los micrófonos apagados, en el momento en que les pida poder hacer algunos ejemplos para poder conversar o hacer algunas charlas, puedan ustedes levantar la mano virtual para que así puedan eh, tener activado el micrófono, ¿ok? Ustedes levantan la mano y automáticamente la persona que está conmigo trabajando se va a encargar de activarles el micrófono, ¿ok? Ahora, el chat de Zoom ya está activado. En el momento en que yo les pida, por favor, me puedan enviar algunas a lo que les pida al chat. No se olviden, también pueden hacerlo y para poder leerlos, ¿ok? Por último, así el día de ayer también hemos tenido bastantes preguntas. Si el día de hoy tienen alguna pregunta relacionada con el área médica, con todo gusto voy a poder responderles. Simplemente escriben en el chat para que podamos nosotros trabajar con ello, ¿ok? Bueno, dicho todo esto, vamos a empezar. Voy a empezar con lo que ya habíamos realizado el día de ayer. Vamos a hacer un pequeño repaso, ¿ok? Vamos a cambiar ahora el switch para poder empezar a hablar en inglés. Well, now let's start working with this. We're going to start working with a review, okay? Let's review the most important parts, most important parts. One of the parts are these suffixes and prefixes that we talked about yesterday. So we talk about some basic anatomical terms, right? First of all, we talk about the body parts that it is. So let's check a little bit. Let's check it out. So we have everything related to the head. We're going to start with, the head. We have the nape, we have the nostril, we have the forehead, the eyes, the eyelids, eyelashes, eyebrows, nose. What about the lips, the tooth or teeth, tongue, the throat, right? We talk about all of this vocabulary that is very important to know. So we already talked about it yesterday. Then we continue with the part of the eyes, so which is the iris, the pupil, sclera, and the conjunctiva that we have inside, right? Then we talk about the trunk, with this, which works with the shoulder, neck, the chest, breasts, abdomen, waist, hips, back, arms. And in the arms, we have another kind of vocabulary, right? The upper arms, the bicep, the elbow, the forearm, the wrist, the hand, palm, fingers, thumb, index. We have the middle finger, the ring, the little, which is called also the pinky. This is the fist, right? And this is the nails, and these are the knuckles, the palm, right? We also have the part of the leg, so the buttock, the leg, the thigh, knee, calf, shin, ankle, toe, heel, sole. Also, we have some internal organs, which talks about brain, heart, lungs, liver, kidney, stomach. It's very important to understand stomach. The intestines, the lower, the long and the large, the thyroid, the bladder, right? Also, some other directional terms like the interior, the posterior, superior, inferior, which is below, right? The lateral, the side, the medial, lateral, as I told you, and proximal. And also we have this other directional term, the sagittal plane, the coronal plane, and the transverse plane, which is very common in medicine, right? Some examples. Then we talked about some prefixes. We have a lot of, some of them are cardio, hyper, hypo, inter, intra, peri. Obviously, this is important to understand. The prefixes are the group of letters that goes before a word. We link before a word, right? But we have more: bi, micro, poly, des, neo, tachy, trans, right? Examples: tachycardia, right? Transdermal, maybe a multinuclear, microscope, right? Then we have suffixes. It is iris, ology, ectomy, photogram. So all of them are suffixes. What is a suffix? A group of letters that goes after, just right after the word, right? So some of them, like for example, rhea, like rhinorrhea, right, the running nose, or diarrhea. We have also urea, so hematuria, right? Some others are otomy, for example, tracheotomy, or ostomy, right, a colostomy. Could be a scopy, for example, endoscopy, or maybe algia rather than myalgia, right? Or myalgia. We have other ones like graphy, right? Radiography, melange, cardiomegaly, right? Matter, thermometer, right? And some other suffixes like pinia, leukocytopenia, right? So those were some vocabulary terms with prefixes and suffixes. Don't forget that we can use the prefix, but the prefix, but the prefix, but the word, and the word. We can work with the word and the suffix, or we can work with the three of them: the prefix, the word, and the suffix, right? So they can go together. So some professional introductions, like good morning, my name is Dr. Espinosa, or I am Nurse Flores, right? We have also some common medical questions. So what brings you here today? How long have you had these symptoms? Are you allergic to any medication? And something important that I have to tell you. It depends on how good you speak the English language in order to realize or do or make some questions. If you have an A1, A2, or B1 level, the best option to work with questions is just in simple present or simple past. Like, what brings you here today? Where does it hurt? What are the symptoms? How long have you had these symptoms? It's just present perfect. So that means that how long ago? And you can say, how long ago did you start with the pain, right? It's something very easy to talk about in past. If you have a B2 or upper levels, so you can work normally with the present perfect, past perfect, or conditionals, okay? Are you allergic to any medications as well? Then we have all of this. So like some commands like, please lie down on the bed, breathe in, hold, now breathe out, right? That we have already talked about. Some symptoms that is very important to know how to do it in English, like I have a headache, I feel dizzy, nauseous, tired, right? Yes. And all the aches that we can have, stomach ache, toothache, maybe earache, headache. And in general, the aches, would say my body aches, my arm aches, right? Let's continue. Until there, we have the diagnosis. You have pneumonia, right? On the treatment, I will prescribe you antibiotics. You need to rest and drink plenty of fluids. It's also great. So, and some clinical communication skills that we have already talked yesterday about it, and that we did already some examples, okay? Today we're gonna finish with all the presentation, and we are gonna work with these little examples. We're gonna participate and start working with that, okay? So doing a short conversation as if you were a doctor and a patient. That's what we are going to do today. And we are here reading and interpreting medical records. That's what we have to continue working today. So now that we review everything that we did yesterday, let's continue with this. So we have some common medical abbreviations, and this is very important because the objective in this, the goal is to recognize and understand the most frequently used medical abbreviations in patient charts, right? So by the end of this subject, you will be able to recognize all the abbreviations, okay, that you can use in hospital or medical institutions. So let's continue with this. We start with BP, that is blood pressure, blood pressure. So the HR, heart rate. Please be able, be free to tell me. For example, what is heart rate? You can, even if you want to write the chat in Spanish, great. So heart rate is in Spanish this, okay? So temp means temperature, and we have this WNL is within normal limits, right? DX means diagnosis, or the TX is treatment. We also have the RX, prescription. As I told you, we don't say recipe in English talking about medical prescriptions, okay? We don't say recipe, we say prescriptions, okay? That is very important. Okay, let's continue. We have also the HX, which means history, obviously the medical history, or the FX means the fracture. So that is very important as well, right? Let's continue. So let's talk about some what is related to time and frequency. We can write with once a day, QD, once a day. BID, which is twice a day. Why comes BD? D is B for day, and BI means for B, two, right? So twice a day, right? TID, 3 times a day, okay? T is from 3. Then the other one is QID, 4 times a day, QRD, 4 times a day. Then comes the PRN, this as needed means as needed, or maybe that start immediately. Let's continue. These are some places that we have in the hospital and clinics. So hospital and clinical settings could be the ICU, which is intensive care unit. Intensive care unit. I don't know, in Spanish means unidad de terapia intensiva, right? Unidad de terapia intensiva, so the ICU. Sorry. We have the ER, emergency room. We have the OR, which is the operating room, or maybe the IV, intravenous, that we talked about yesterday, just when you was a canalizado or something like that, was intravenous, the IV. IM is intramuscular, so when you receive a shot, right? What is a shot? Is an injection. And here I have to emphasize this. I'm going to stop here. When we talk about injections is that, las inyecciones, right? Well, when you have to receive an injection, the formal way to say that is injection, but the common way that everybody uses is the shot. So I need to receive a shot. That means an injection, right? And IM shot. That means an intramuscular injection, right? NPO, nothing by mouth. That means with no eating, nothing by mouth. So I would like you to tell me what is in Spanish the meaning of nothing by mouth, because obviously it doesn't have the same acronym and it's not the same way, right? So when you cannot eat, how does it work? Nothing by mouth. So please think about it, and let me know in the chat if you can write it. Do it, please. I don't know if they have the chat of the Zoom activated. Please, can you check it? We're gonna continue now with the emergency situations and first aid vocabulary. Okay. So what happened here? So we're going to talk about first aid, some primeros auxilios, right? Primeros auxilios. In this case, we have the key phrases for emergency. Trauma and injury. So what does the person in charge of the emergency call, or maybe the person who is in the ambulance has to do? Where is the bleeding coming from? Apply pressure to the wound, right? Apply pressure to the wound. What does it mean? Hacer presión en la herida, right? To keep the patient still. And this is important. To keep the patient still means that you need to keep the patient awake. What is awake? That means he must not sleep, right? Yes, still, very good. Now, let's continue with the resuscitation and cardiac arrest. Check the airway, the breathing, and the circulation, the A, B, C, right? Start chest compressions, right? I think it's like this, right? Call for the defibrillator, okay? Defibrillator, okay? So that is also another one that you can use. So just in case all this material, you can have it. You just have to ask the person in charge by the telephones that you have in the YouTube and also here in the chat, okay? Now, I don't know if you have a specific number to call. 911 is an international emergency. Here is in Bolivia, for example, I think is 101 or 111, I think. No, 119, sorry, 119, that it is. But I'm sure you know the number of telephones that you have in your country, right? Look at this. Wait for help, perform CPR. That is the CPR. Yeah. Also, we have the left chin, left chin in order to make the person breathe. Check breathing, check vital signs, right? All of these situations that you have to know in first aids. So let's continue. Check blood pressure, heart rate, and oxygen saturation, right? That is what we have to do. The patient's pulse is weak, that means débil, or maybe strong, right? Respiratory rate is irregular. Respiratory rate means the breathing. That is the normal, and I assume that irregular should be, or maybe very paused. Very weak, right? So that it is. So we already have this general emergency phrases. Stay calm, for example, stay calm. Help is on the way. Help is on the way. Do you feel any pain? Where? Can you hear me? Can you hear me? Open your eyes. Open your eyes, right? Some of those specific phrases that you may know. Obviously, that it doesn't mean that these are the only ones. No, obviously, since you are you are the professionals, you may know more specific phrases that you may ask, right? So we're gonna start working now here. Maybe we can start working with this. For example, I would like you to start working with some specific situations. I would like you to write some more general emergency phrases. Can you write it, please, in English in the chat, please? I will be checking the chat so you can write it and I can read it, please. I have one. Y sacar sangre, Romina Velasquez. Yeah, thank you very much. Well, we don't have this expression specifically, sacar sangre. Okay, sacar sangre. What we can say is to take blood sample. to take blood sample. Take blood sample, that is means tomar una muestra de sangre, right? What is the correct one? Sacar sangre is not also very common, but in Spanish, yes, it is. It is, me voy a sacar sangre, but in English is to take some blood sample, okay? Thank you very much for your question. Please, I would like you to start writing some general emergency phrases like stay calm, help, do you feel any pain, where? For example, do not move. Try not to move. Keep the patient without moving, right? There's another one. What else can you tell us about it? Please tell me. You can write some specific phrases or maybe sentences, okay? Pueden escribir unas oraciones quizá para poder enriquecer un poquito más todo lo que ustedes ya saben. If you want to do it in Spanish, do it. I will tell you that in English. And if you want to do it in English, better. I'm checking now this. Buenas tardes, Angélica, ¿cómo está? Bienvenida. Buenas tardes a todos. Mr. Jordan, it says, here he has a question, and it says, no consumir alimentos sólidos. Yeah, that's what you said, right? How do you say that in English? Okay, when you want to talk about that, you can tell the patient, do not eat solid foods. Okay, do not eat. Do not. Why do not? I'm gonna tell you this in Spanish. Tenemos una forma, do not y don't. Okay, el don't es la abreviación de do not. There is no problem. Si ustedes dicen don't eat solid foods, están diciendo no consumas alimentos, pero no es una orden. Ok, no es una orden. Ok, pero cuando es una orden, lo que debemos hacer es no utilizar abreviaciones. Do not eat solid foods, or consume if you want. Do not eat solid foods. Entonces eso sería lo más importante, ¿ok? Because this is something that the patient must follow, right? Here I have en español decimos puje a la mujer en el momento del parto. Ok, pujar es to push, ok? Just push and push and push, ok? Push it, ok? Push, just that, ok? Do we have some others? Okay, great. We are going well. I'm gonna check the YouTube. Maybe we have some questions also there. Nothing by mouth es lo mismo. Yes, nothing by mouth means no consumir nada de alimentos. Nothing by mouth is different by solid. I told you do not eat solid foods. No consumir alimentos sólidos, but nothing by mouth means nada de manera oral, nada. I mean, no solids, no liquids, nothing by mouth. Esa es la diferencia, nothing by mouth, but it's correct. It's correct. Bath in my mouth is correct, okay? Nothing by mouth is very good, but you mean nothing that you can introduce to your mouth. That is, no solids, neither liquids. So, So we have other, oh no, my pleasure, Mr. or Miss, Mr. Jordan. No more, I have here some, I don't know if we have more. No. Okay, well, so thank you very much for participating. Thank you very much for participating. I forgot to continue watching this YouTube. Yeah, very good. Let's continue. Okay, so here we are. Let's continue with the quick communication with emergency services, which is also important, right? So, calling emergency services. So when you want to talk to the emergency service, I mean the ambulance could be. This is an emergency. We need an ambulance. This is an emergency. We need an ambulance. Obviously, it is very important to understand that these are not the only sentences that you may use. No son las únicas oraciones que pueden utilizar. I already told you, okay? We can use many others. That is something that you want to. It's just that, okay? So here I have, I think, one more. No, let's continue. So this is an emergency. We need an ambulance. Also, we have the patient is unconscious and not breathing. Obviously, this is a very specific case, right? Unconscious and not breathing. We are at, be specific, we are at, there it says location. You need to give the specific address in order to wait for the ambulance, right? And how do you tell the address? Well, I know that in that moment is very difficult and you're very nervous, but I think that it's possible. Sorry. For example, we can say this is an emergency, we need an ambulance. We are at the location. First, you have to tell the number of the house, the place, right? For example, the number of your house is 23. So you have to say, okay, number 23. Then you have to say the floor. That is the correct way. Second floor. If it's not a floor, just a house, you can tell them the street or the avenue, right? I don't know. For example, it's number 23 North Avenue, or on the corner of North Avenue and 50th Street. I don't know, right? Also, it's possible to say the floor and the number of apartment. I mean, upside down. You can say, okay, this is apartment, this is the 5th floor, apartment 2B on I don't know, 2nd Street, on 2nd Street. That's it, right? Or maybe East Part, 2nd Street. I don't know. You have to tell them the specific number, but this is the way, okay? Don't forget that. Please come quickly. Yeah, please come quickly is a very formal way of saying, por favor, vengan rápido. The common way, I'm telling you that the formal and informal is the please hurry up. Hurry up. Hurry up is another way. Please hurry up. That means we need to have you here right away, right? That it is. Another one, please do not be so late. I don't know, but the most common is come quickly, hurry up. And we have also some others, right? You're gonna be asked about some specific information about the person who is bad or who needs the ambulance or who needs the emergency, and that is transmitting patient information. It's male, means masculino, or female, femenino. Approximately 40 years old. Could be. He is approximately 40 years old. He is like 40 years old. Like 40 years old. Como unos, right? He may be, no junto, no maybe, he may be 40 years old, puede tener unos 40 años, he may be 20 years old, 23 years old, he may be as well, okay? It could work very well. Another one is severe chest pain, difficulty breathing, a severe chest pain, un dolor severo en el pecho, right? Difficulty breathing, that is, or maybe you can say he cannot breathe. That means that he's not breathing. He cannot breathe or he's breathing difficulty, right? What else? Possible head trauma. Well, possible head trauma, you don't know very well, but you can change a little bit the possible head trauma. Well, he hit on his head. He hit on his head, or his head is bleeding. He has a wound. What is wound? Una herida. He has a very big wound on his head, or maybe he hit his head. If you want to say he had the possible head trauma, could be, but you don't know, right? So you have to tell them what you see. Now, to continue this, it's important to say what you see with the patient, right? That it is. Now, to continue working with this, I would like you now to write down on the Meet, on the chat, on the Zoom chat, all related with calling emergency services and transmitting the information of the patient. So imagine that you are a person who is calling to emergency, and you want to tell the emergency that the person who is in front of you needs an ambulance. So how can you tell them? I mean, write in the chat some other information that you may add. For example, I don't know, maybe you can tell the person and not only come quickly, he's male, he's like 20 years old, he's not breathing, or maybe he fainted, está desmayado, he fainted, he doesn't move, he fainted, or maybe he got an accident, a car accident, he's on the street, he has some problems breathing, or maybe he has a broken arm or a broken leg, and that's important. Broken arm, broken head, broken head. What happened if it's not broken? Maybe like this, it's a twist. What is twist? A twist ankle, right? Torcer. El tobillo está torcido, they say, right? So I have a twist ankle, a twist wrist, I don't know. You can tell, okay, the arm is out of its place. The arm is out of its place. Another way to say that. El brazo está fuera de su lugar, right? The arm is out of its place, okay, or maybe the neck is broken, or the neck is to one side, or I can say the upper arm is not in its correct place. The shoulder is out of its place. You can say also one of his finger, I don't know, the the middle, I mean the index, the middle, the 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 ring, or the little, or maybe the pinky. So one of them, I don't know, the pinky little is out of its place. You know, it's on one side, está a un lado, it's on one side, it's to the left side or to the right side, according to how you see in that moment the patient, right? You have to give all the information to the person, you know. It's bleeding a lot, it's bleeding. Just when you say it's just bleeding, está sangrando mucho, right? But if it's bleeding from another place, okay, the head is bleeding a lot, has a wound, or maybe he had a very big cut in his chest. I don't know. There are many ways to describe the patient. Okay, I am telling you all the possible situations that you may use, and obviously, you can do it as well, right? So let me see. Yeah, let's continue. Let's continue. We're having this presentation well done. So confirming instructions. Should we begin CPR now? Should we begin CPR now? So that is something else, right? Do you recommend oxygen administration? Obviously, this is a person who is already in the 911, right? Down. To paramedics. Patient has no allergies, vital signs are unstable. Unstable, no allergies. We started fluids and oxygen therapy. We started IV fluids, IV fluids, intravenous, right? IV fluids and oxygen therapy. If you would like, I would like, well, actually, I would like you to write some other recommendations that you can do to paramedics, okay? Please, can you write some other, please, on the chat of Zoom, or maybe on the chat of YouTube? You can write, please, some other instructions that you may know, that you may want to know. Could be in English or maybe in Spanish, but just do it, please. I will be waiting for you in case of you need some help. Okay, you can write it. There's no problem. You can write it, please. I'll wait for you a little bit, please. Okay. So I'm checking. Buenas tardes, Jocelyn. Welcome. Roxana, welcome. Baki Romero, buenas tardes. Yeah, thank you very much for logging in. So let's continue. So if you don't have any other question, so can you write it some in the chat, please? No sé si está activado los chats, Miss, que pueda verificar, por favor, para que puedan escribir. Okay, thank you. Buenas tardes, Miss Soraya. Please, you can write some other instructions. Could be instructions, or maybe some other requests, okay, that you may know. Just write it, please. Just write it in the chat, please. I will be waiting for you. I will check it also, the YouTube chat. Okay, here I have one. ¿Cómo sería conmoción cerebral? Okay, well, conmoción cerebral, right? What is this? Yeah, conmoción cerebral. Well, you can say just I don't know if it's okay. It's a concoction, okay? Yeah, that it is. Okay, it's just concoction. I hope you listen to me. Another one. Here I have another one. Okay, let's continue. So let's continue. Let's work with hospital and clinical environment. Okay? So, we already talked about this. The emergency room, the ICU, intensive care unit, the operating room. So we have all of this here, but we have also some other ones, right? So the lab analysis, for example, we have another one, labs analysis, surgery room, right? The structure, the structural imaging, that means when they take you the x-rays, room, right? So there's another one is the follow-up. What is the follow-up? The follow-up is a place in which you can you can be checked, okay? Be checked, that it is. Yeah, that it is. And then let me open the YouTube. It's closed. That it is. So those are the places. Look at this. We have the OR, the operating room, the radio treatment, laboratory as well. So we have pharmacy, some pediatric ward or maternity ward also. We have some those areas that you may know. And lab analysis, the lab analysis in which you the laboratory analysis, right? And that it is as well. Okay. We also have some basic medical equipment. And I'm sure you may have more, right? So that is, for example, the stretcher, the wheelchair. You know what wheelchair means, right? The wheelchair means silla de ruedas, right? The stretcher means camilla. Hospital bed, a common hospital, which is a little bit different, right? It's not like a common normal bed. A thermometer, right? Blood pressure cuff. What is the blood pressure cuff? It's something important because now we have different kind of blood pressure device. So, for example, the blood pressure cuff is that little bulb, if I can say bulb, that you do this. So you introduce air to see the blood pressure. So that bulb, that is the cuff, okay? The blood pressure cuff, okay? So let's continue with this. We have the stethoscope. You already know the stethoscope. The IV drip. What is the IV drip? So you know the IV, right? Intravenosa, right? So the IV drip is the one that you introduced this, right? Oxygen mask, right? The syringe, the injection, the syringe, right? Scalpel, you know, is the same as in Spanish, scalpel, the same. Globes, you know what all doctors use to operate or to check globes, the plastic globes, right? Or the gum globes. Bandages, yeah, bandages. Bandages. Let me tell you this. Bandages are all those things, if I can, that you use to evolve a part of the body, right? The bandages. Also, they're the little ones, right? First aid kit. You know, there's first aid kit is botiquín de primeros auxilios, right? Plasters. You already know what plasters is, right? The plasters, the one that you have to move, right? The cotton wool. The cotton wool. Some torundas, right? The cotton from cotton, right? That it is. Buenas tardes. Hello, hello. Here I have a question. Okay, let me understand your question. Here says, ¿cómo sería como toma de presión arterial o más se refiere a la acción de inflar? I think what you want to ask is, ¿cómo se dice tomar la presión arterial? Creo que es lo que usted desea saber, right? As to take the blood pressure, but maybe I didn't understand, tal vez no entendí. To take the blood pressure. Oh, now I understand what you mean. When you do the blood pressure cuff, right? No, the blood pressure cuff is the device, es el aparato. The blood pressure cuff es el aparato para tomar la presión. Es el aparato para tomar la presión. Okay? That it is. Maybe that's what you wanted to know. Thank you, thank you. If not, please continue writing in the chat. Si es que no esa es la respuesta o maybe estoy equivocado, por favor continúe colocando en el chat para que yo pueda comprender. Okay. Thank you very much. Thank you very much. Okay, let's continue with this. The surgical mask. You know what is a surgical mask, right? The surgical mask, right? The ones that the doctors use when they have a surgery, right? That it is. That it is exactly. Okay. Now, let's continue. The stethoscope, you know, well, that is also good, right? The oxygen mask is different, right? The surgery mask from the oxygen mask is different, you know, the máscara de oxígeno. Sometimes you have a mask, sometimes you have just some tubes that get inside the nostrils. The eye chart, scales. What is scales? The scales is las balanzas, right? And what is the eye chart? The eye chart is that printed paper with a lot of different letter sizes. Different letter sizes. Es ese gran papel impreso con diferentes tipos de tamaño de letras that doctors use to check your eyes if you see well. The first letter is a big E. Do you know? That is the eye chart, okay? So the resuscitator, well, I don't know if you know the resuscitator, that thing that you have when you do this. Do you remember? You do this manually. So you put it in the mouth and you start giving the patient air. You blow it and then again you blow it and again you blow it and again, right? So that it is. That is the resuscitator. Pregnancy testing kit. Everybody knows that. I just wanted to add it. The pregnancy testing kit is already in any kind of pharmacies or drug stores. The compression bandage is different than just bandages, right? The compression bandages are elastics, which you can evolve the part which is bad, and it offers or shows pressure, gets pressures to the body, right? That it is. We have more pills. Pills, are the ones that we take orally, right? The X-ray, the X-ray. The IV, the IV. What is the IV? La intravenosa, right? The urine sample. The urine sample are those little maybe boxes, maybe those little bags that you have in order to introduce your urine when you pee, and it has to be evaluated by the doctor, right? That it is. The drop-in bottle. Drop-in bottle is the drop-in bottle is a bottle. It's a bottle in how can I explain this? The drop-in bottle is a bottle, a common bottle, but in which you can you can take some drops, right? Take out some drops. That it is, in which you can also have the injections as well, right? So another one is the dropper, which is different. The dropper means just gotero, right? A gotero. I can tell you, for example, the drop-in bottle, if the one that you use when you want to put some drops into your eyes, the drop-in tears. So those are drop-in bottle, right? I think you may understand better in that way. So the dropper is just the little thing that you use to take some liquids and then pour it, drop tear by tear, gota por gota. That's gotero, right? The needle. What is the needle? The needle is that little metal part of the injection which you introduce it to the body in order to put some injections, right? Some shots. So it means la aguja, right? That's the needle. Antiseptic. We know what is an antiseptic, right? The examining table. Well, the examining table is are most of the time in some consultory places, as I told you here, in which you can tell the patient to lie down, right? So you can check the person. So that is the examining table. Let's continue. Well, we have already with those have everything with those medical equipment, but I'm sure that you may know more. Maybe you may know more, but why don't you start working with that? Can you tell me, please? Can you tell me? Can you tell me? Maybe you can write it. You can write it on the chart, on the chat, the Zoom chat. Write it on the Zoom chat. Some other medical equipment that you know. Could be in English. Better if it's in English. If it's in Spanish, it's okay. You can write it and we can tell you what is the in English. Please write it down. I will wait for you a little bit. Okay. So nobody else? If you have any other medical equipment, just let me know. I will be very happy to tell you. Or if you know in English, just write it down on the chat. Could be in the Meet chat or could be in the YouTube chat because we are in both places. Please, you can write it down, okay? You can write it down. Continuando, déjenme indicarles que no se olviden escribir a los teléfonos que ya les han enviado al chat de Zoom y al chat de YouTube para poder obtener los certificados correspondientes. Asimismo, si tienen cualquier consulta, pueden hacerlo mediante los chats, tanto de Zoom como de YouTube. ¿Ok? Please continue, continue. Do it, do it. Write it, please. Write some information that you may know. Thank you very much and hello. Thank you for being here, Mr. Antesana. I'm very happy to have you here. Thank you very much, Dr. Rios. Thank you very much, Dr. Rios. Thank you very much. Please continue writing, please, writing. Escriban, por favor, algún otro equipo médico que ustedes deseen saber, o quizá ustedes ya lo saben y pueden colocarlo en inglés. Please do it, because it will be for all of you. Porque esto va a ser para todos, porque yo voy a ir leyendo y así vamos a poder aprender todos de lo que va a ir sumando a lo que vayan escribiendo, ¿ok? Please, just continue working at it. Please, do it. Scalpel, very good, Imelda. Scalpel is very good. That is great, scalpel. Yeah, we have the scalpel. It's the little knife that we use to, right? The electrocardiogram. Electrocardiograma is electrocardiogram, okay? Electrocardiogram. It's electro, the prefix, cardio, the word gram is the examination, right? Electrocardiogram. Here I have one. It says, how do you say, let me check it. How do you say incubadora? Creo que está mal escrito. A ver. Let me check it. I'm gonna check it. Oh, no. That was wrong. That was incubadora. Okay, so incubadora. Well, this is just the same as in Spanish, as in English. Incubator. Tenemos más. Incubator. ¿Cómo se llama el carrito de emergencia? I don't know what you mean. El carrito de emergencia. No sé si se refiere a la ambulancia o al carrito de emergencia, ese pequeño. Bueno, creo que entiendo lo que me dice. Torniquete, enseguida le digo torniquete, just tourniquet, ¿ok? Tourniquet, just tourniquet. No sé el carrito de emergencia. Si tuviese el nombre, obviously, I will tell you. But you can also say emergency, the emergency, carrito de emergencia. I will let you know, okay? Let me find out the word. Let me find out the word. Ok, ¿cómo se dice sillón odontológico? Ok. We have sillón odontológico, ok. That is good. You can say, sería odontológico, odontology armchair. Sorry. Odontology armchair. Armchair. And when you say turbina de vapor, right? And what it says? Yes, turbina de vapor. Okay. Turbina de vapor is just the steam turbine. Steam turbine. Steam turbine. Okay. Steam turbine. Yeah. No, it's not the stop car. It's not a stop car. Okay. En Paraguay le dicen carro de paro. Okay. Well, I'm gonna check it. Don't worry. Lo voy a revisar y hoy al finalizar el seminario le voy a indicar, ¿ok? Porque hay diferentes tipos de formas de decir en diferentes países. Pero si me da el tiempito, antes de terminar la clase, el seminario, yo le digo, ¿ok? No problem. I won't forget Mrs. Ramírez, ¿ok? Oh, yeah, carro rojo. Yeah, that is the red car. The red car, I'm not completely sure. Lo utilizamos para emergencia cuando un paciente cae en paro. Okay. Okay. I understand what you mean. Yeah, well, el paro cardíaco, paro que es just the I think I understand what you mean. Let me check it, okay? Let me check it and I will tell you. Don't worry. Les voy a indicar al finalizar el seminario. Don't worry. Okay. How do you say catheter? Oh, that is a very good question. Catheter is the same as catheter. Porque en inglés la T y la H no tienen un sonido de T, es como si estuviesen botando aire entre los dientes. It's catheter, okay? Catheter. I hope you listen to me. Then it says ampollas de vitamina C. Okay. Ampollas de vitamina C. Well, that is just the vitamin Z. Equipo de venos. Okay. First days, okay. Ampollas de vitamina C. Just vitamin C ampoules, okay. Vitamin C ampoules. And then, ¿qué dice ahí? Equipo de venoclisis, you said, right? Well, it is the same. It is the same. The venoclisis, yes. It is the same because venoclisis is just the same. Could it be IV equipment? IV equipment, okay? IV equipment. No olvido que me preguntaron por el carrito de paro. Voy a colocar, voy a ver cuál es el sinónimo acá y les voy a poder indicar, ¿ok? Don't worry. So let's continue. Well, thank you very much for letting me know. I forgot to see the YouTube chat. Let me check it. Let me see. Yes, let me check it. Here it is. Well, here we are. Ya. ¿Cómo se pronuncia tut y tit? Ok. Primero que nada, diente, tut, es la T, la U y la TH que es tuts, tuts. Y lo mismo con dientes, teeth, teeth, teeth. Again, tooth, teeth, tooth, teeth. Okay? So, who else? That it is. Well, thank you very much. Thank you very much. Let's continue. Well, I hope, well, if you have any other question, you may tell me. Let's continue. Let's continue. It says hospital and clinical environment healthcare professionals. And here I want you to explain yourselves, okay? Acá nos vamos a explayar. But first, let's start working with this. First, it says doctors. This is the first healthcare professional, right? Doctors. I mean, general practitioner, surgeon, cardiologist, pediatrician, and anesthesiologist. If you realize doctor is the general connotation or the general name for all the personnel related to the healthcare, the professional, right? Obviously, it is divided. It is divided in specialist, cardiologists, pediatricians, the general practitioner, the surgeons, internists, and the anesthesiologists, right? Neurologist, what else? A traumatologist, etc. But there are also subspecializations. También hay subespecialidades, right? Subespecialidades. So you can tell me, I don't know, for example, I don't know, I just came to my mind, could be the person who takes care of children, right? El pediatra, right? The pediatrist. Also, the specific, the specialty could be the cardiólogo pediatra, I don't know, or pediatra cardiólogo, or you can say you just cardiologist, pediatrician, right? Could be, right? So that is in the general way related to all the doctors, right? But we have more, and we are going to work in this moment. Don't worry. Let's go with the next ones. We have nurses. Yes. Who are the nurses? The nurses are the person who help doctors to treat the patient, right? To be with the patient. And in that way, here, no, okay. So in that way, we have the registered nurse. The registered nurse is just the nurse, okay? But then we have the nurse assistant. The nurse assistant, las asistentes de enfermería. Maybe you know this in some other places with other names. Tal vez lo conocen con otros nombres. I would like you to tell me in the chat, okay? The head nurse, yeah, the head nurse, this is the most important person that is in charge of the nurses, okay? That is in charge of the nurses, okay? That it is. Okay, so that it is. Then comes the other care staff. For example, the pharmacist. Yes, the pharmacist. The pharmacist is very important in a hospital, right? El farmacéutico, the pharmacist, right? The pharmacist. Also, we have the physiotherapist. The physiotherapist, right? The physiotherapist. The radiologist, paramedic, lab technician, la persona encargada del laboratorio, el laboratorista, right? So the physiotherapist, el fisioterapeuta, right? Radiologist, paramedic. And we have the other support staff, like, for example, receptionist, La recepcionista, the janitor. You know what is janitor? The person who cleans and do this, right? The orderly, etc. All of them are very important, okay? But now, uh, it's very important that you tell me your professions, okay? It doesn't matter if you're a doctor or a nurse or other staff of the hospital or the healthcare side. You just let me know. Dígame, por favor, escriban en el chat que yo voy a empezar a leerlo, ¿ok? Voy a también leer en el chat de YouTube. Por favor, coloquen cuáles son las profesiones que ustedes tienen o que saben, ¿ok? In English. If you don't know, there is no problem, no hay problema. Lo pueden colocar en español y yo con todo gusto les voy a decir en inglés, ¿ok? Vamos, les voy a dar unos segundos. Les voy a dar unos segundos para que ustedes puedan colocar. ¿Ya? ¿Ok? ¿Ok? Come on, do it, do it, do it. I will be checking. Thank you very much. Acá tenemos algunas. A ver, vamos a ver. Aquí primero. A ver, thank you so much, teacher. How do you say médico general? Well, médico general. Well, it's just the doctor. The doctor. And is the doctor, okay, doctor. But if you want to say specifically to the general doctor, okay, general doctor, and also good afternoon, Isabel. Thank you very much for being here. Oh, plastic surgeon, very good. Cirujano plástico, plastic surgeon, pediatrician, pulmonologist, hematologist. Very good. Very good. Thank you very much. That is excellent. Luz Oporto, thank you very much. Thank you very much. Here we have teacher. It says, how do you say interno? No sé si estoy en lo correcto, médico internista o el estudiante interno. Ok. El estudiante interno del hospital. There is not a specific name. There is not a specific name for estudiante interno, but you can say, for example, the intern and hospital intern student. Hospital intern student. Okay. El estudiante interno del hospital. Hospital intern student. Intern means que estás haciendo el internado, ¿verdad? El internado, creo que es a eso a lo que te refieres. Yes? Very good. The hospital intern person, intern doctor, intern student, it depends on where you are, okay? El internado is the boarding school, the place, and you obviously you are there, so you can be the intern or boarding student, hospital boarding student or hospital intern student, okay? Both of them, hospital boarding student or both hospital intern student. Continue. Thank you very much. Thank you, sir. If you have some more questions, some other questions, I will be very happy I will be very grateful to help you, sorry. I will continue waiting for you. Write down. It's very important to know. Neurologist, for example, cardiologist, some other words, some other ones. I don't have any more. Yes. Vamos a ver acá en el chat. Yes, pathólogo. Pathólogo. Pathólogo is the same, okay? As you said, it's the same. Pathólogo is just pathologist. Y algo muy importante que les voy a hablar con ustedes es lo siguiente en Spanish. Hay muchas palabras que tanto en inglés como en español, como en portugués, tienen la misma raíz. ¿Por qué tienen la misma raíz? Porque son palabras genéricas lingüísticas. ¿A qué me refiero con palabras genéricas lingüísticas? Son palabras que simplemente no tienen una traducción específica de un idioma a otro. Entonces, se designan como tal con una pequeña distorsión en un idioma diferente. Por ejemplo, patólogo, pathologist, neurólogo, neurologist, ¿ok? Neurologist, cardiólogo, cardiologist. ¿Por qué? Porque las palabras, en este caso médicas, tienen una raíz específica, cardio, ¿verdad? Entonces, eso no cambia. Entonces, simplemente es un poquito de alteración en cuanto al idioma que uno quiere traducirlo, digamos. ¿Ok? Eso es lo que podría yo indicarles. ¿Alguna otra consulta? Dentist, very good. In a rate of 1 to 10, how much does it hurt? Very good, Romina. Thank you very much. That it is. Thank you very much, Romina. In a rate from 1 to 10, how much does it hurt? Very good. I like it very much. Okay, so también importante saber the other stuff, right? You didn't tell me anything about the other stuff, right? But let's continue. Let's continue. Rules and etiquettes. What is a rule and what is an etiquette? I mean, all those signs that you can see in the places, in the hospitals or clinics in which you need to follow, right? Which you need to follow. Okay, I have to go in that way. Okay, I don't have to get into this place, right? So we're gonna talk about now the rules and etiquette. So, wash your hands before and after patient contact. That is something that you have to write, right? Lavarse las manos antes y después del contacto con el paciente, right? Wear gloves, right? The device that you put on your hand. Masks. And protective equipment when required. What is the protective equipment? Well, you can maybe have the face mask. Maybe you need to wear some protector glasses. I don't know, or medical glasses. I don't know. The medical hat, right? The medical hat, right? Or the medical hat that it is. Or the beret, the medical beret as well. You can say the medical beret as well. And all those, right? All the costume that you need to wear. So Respect patient privacy and confidentiality. Oh, respect patient privacy and confidentiality. Yeah, you know what it means, right? I don't need to go deep on it. Roles and teamworks. Doctors diagnose and prescribe. Yes, doctors diagnose and prescribe. I told you, prescription is receta. Prescribe is recetar, okay? Nurses monitor and provide direct care. Nurses monitor and provide direct care. Yes, they are the very important people to help doctors to do their job, right? Technicians operate medical equipment. Yes, the technicians operate medical equipment like the X-rays and etc. But I don't want to continue now. I want to stop here in order to let you know more. So some other rules that I'm sure you know. Please, could you write on the chat, in the chat, some other specific rules that you know, in English or in Spanish, there is no problem. If it's in English, better, so we can show to read for all the participants, or in Spanish, so I be able to I can translate. I may be able to translate, so you can work in that way. Okay. So please don't forget to start writing. Please, I want you to write everything. Please, I will give you some minutes to write in the chat so you can start working with it. I will check here. Oh, very good. I studied for a degree in law, but I like to learn English. Yeah, Ms. Maria, thank you very much. You are here, and that is very good. Thank you very much for being here. Hello, Genia Cherry. Buenas. Hello. Thank you very much for being here. You can continue working here, and if you know anything about what I'm telling you to write, do it, please. Si pueden hacerlo, empiecen a escribir algunas otras reglas que se tienen para los doctores, los pacientes, las enfermeras o las personas en general que ingresen al hospital, right? Some rules, algunas reglas. Please, just tell me, por favor, solo díganme y con gusto yo lo voy a traducir, o mejor si es en inglés, tanto en el chat de Zoom o como en el chat de YouTube, ¿ok? Obviamente, no olvidarnos de ponernos en contacto con los números telefónicos que se muestran en pantallas de YouTube y también en el chat de Zoom para para poder contactarse y poder obtener información para la entrega de los certificados. Asimismo, cualquier consulta pueden comunicarse con el chat y para que yo pueda indicarles o absolver cualquier duda, ¿ok? También poder ayudarles, indicarles de que si quieren todo el material, solo comuníquense también con los mismos números y se les va a hacer la entrega, ¿ok? Disinfect equipment after, very good. After using with a patient, maybe yes. Desinfectar, right? Disinfect equipment after using with the patient or with a patient. Disinfect equipment after using with a patient or with the patient or with a patient. That is very good. Thank you, Ms. Jimenez. Thank you very much. Another one, please. Don't forget to write it. Oh, therapy intensive nurse. Very good. Therapy intensive nurse. Thank you, Katia Aroja Antonio. Thank you very much. Thank you very much. Therapy intensive nurse. Excellent. Thank you very much. Another one. Please just continue writing. I will be very happy to help you. If we talk about roles and teamwork, we have doctors, we have nurses, we have technicians, we have paramedics, right? Paramedical team. We have the paramedical team as well. What else do we have in a hospital? We have the administrative staff. Don't forget about them, right? The administrative staff. And also we have the low staff, because every clinic, every hospital has laws, right? Lawyers, the lawyer staff, right? As well. That is the administrative staff, the cleaning staff, right? That is another one. What else do we have under of the pharmacist? Is there are some other people that works with the history of the doctors, of the patients, right? So those are the one, and also you have this person in charge of the technology in the hospital, right? All of them. So there are a lot of people that work in the healthcare area, right? Hierarchy in healthcare. Yes, we have some hierarchies, and that is what they say. Chief of medicine, specialist, residents, nurses, and assistants, right? Aquí hago un stop. No sé si el residente es el mismo que el interno. Hasta donde yo tengo entendido, el interno es aquel que está por completar los estudios, y el residente es aquel que está haciendo prácticas, ya prácticas profesionales. ¿A qué me refiero? Here in Bolivia, for example, in Bolivia, when you study medicine, you study the 5 years, but the fourth year, en el cuarto año, the fourth year, you are the hospital intern student. Eres el interno del hospital. You didn't finish your studies because you need to continue studying 1 year. That's why you are the intern. But once you finish, you become the resident. Te conviertes en el residente. That means that you have to apply what you know in the hospital. At the very beginning, it was just 3 months, then it was 6 months, and now I'm not completely sure. I think it's still 6 months, or no, I think it's 3 months, but you become now the resident, and that is, okay, that it is, and that is the difference. But if you know more, please let me know. Very good. Thank you very much, Isabel. Thank you very much, Jose. No es lo mismo, right? So that is, the resident is the person who is putting into practice all the knowledge that they have acquired into the studying years, right? During the study years, that is the resident. So that is very different from the intern, okay? So we have the chief of medicine, es el jefe de médicos, right? Here in Bolivia, we have the jefe de médicos, right? El jefe de médicos. Then comes the specialist, all the doctors that have the specialization in different areas, the sub-specialization, the specialist, the subspecialist, the specialist. Then comes the residents. Then comes nurses, okay, nurses, assistants, right? Who are the assistants? All the staff that work at the hospital, okay? clear communication and respect across all roles. Yes, this is very important. I decided to write it here because a clear communication and respect in all these areas are the basis for a good health care condition, right? In that way, everybody is going to work very well. And that is, I'm forgetting another one, just came into my mind, the person who works with the doctors in order to pay la trabajadora social. La trabajadora social in English is the social labor, okay? The social labor, okay? That is another one that I forgot. Thank you very much for letting me know, letting me telling you this. So this is what I need to know. Let's continue with the medical documentation and writing, okay? Medical documentation and writing, okay. So the SOAP notes, the common structure. What is the SOAP? And this is very important. I think you need to write as doctors. You may know more than me. It is S comes the subjective, the patient's complaints. Patients reports chest pain for 2 hours. That's the first thing that you have to write, right? So patient reports pains in the chest for 2 hours. The objective, the observation, observations, vital signs, test results, etc. Blood pressure, do you remember the BP? The blood pressure, 140/90, pulse, 110, right? 8 comes the assessment. What is the assessment? The evaluation, the diagnosis that the doctors do. Okay, that is assessment. Assessment is a technical word, but the general word assessment is evaluación de manera general. But the assessment in medical doctors, in medical English term, technical terms in medicine, diagnosis means, assessment means the diagnostic that the person, the doctor is doing to the patient. So diagnosis or clinical impressions, probable myocardial infarction. And this is just an example, right? This is not something that is going to be always there. So diagnosis or clinical, but what is, okay, the person may have arthritis or osteoarthritis, or maybe the person maybe could be a clinical impression as a lupus, for example, I don't know, or maybe an emphysema, or maybe a subcutaneous, but inside the skin, subcutaneous emphysema, right? What is the subcutaneous emphysema? Obviously, you know more than me that the skin separates from the meat, let's say, and it starts getting some pops up from air or water that you can blow it, but it starts going, it's like wounded, but it's the water that it has in it, right? So that is the subcutaneous emphysema. Or maybe the lungs, you know, the edema, right? The edema, right? Edema, another one. So that it is. What is P? What is the plan? What you have to do? What you're gonna do? The next steps or treatments, right? The treatment specifically. Admit to ICU. That's very important. Yeah, if you have a subcutaneous edema or emphysema, I think you have to go there. I don't know. So admit to ICU, start with oxygen therapy. So that is what you have to write in order to follow your orders, right? If you realize, first, you have to write what the patient is having in that moment, what is reporting, what the patient is reporting. Then comes your specific observations. Then comes your labeling observation. Una observación superficial, right? Maybe you can see, yeah. Then comes the real impression. This is what they have because you did some diagnostics. And then the first steps or orders that you have to do in order to start making the patient feel better, right? That is the SOAP that you need to know. Discharge summary basis. Reasons for admissions, right? What are the reasons? The treatment given, the condition of discharge, follow-up instructions. That is what I am telling you in all this SOAP. Okay? That it is. Here I have a question. I just have seen, sorry. Let me see. It says, teacher, one question, how do you say consentimiento informado? Consentimiento informado. Maybe you refer to the consent that you are requiring for the patient's parents or relatives, right? If you're talking about it, it is the informed consent, okay? Consentimiento informado, okay? The informed consent or the informed consent. That is the way. The informed consent. Yeah, it is. Okay. Thank you very much. I will find another one because I'm sure that there are two ways of saying consentimiento informado. Yes, consentimiento informado. Yes, there are two ways. The one is the one that I told you. Yes. Yeah, it's the informed consent. The informed consent. Yeah, that it is, informed consent. Another one. Let's continue. Let me see maybe we have some other ones here in the chat. Ricardo Pietro, dentistry. Dentistry. Okay. Well, dentistry. Dentistry. I don't know what you mean by dentistry. You may relate it to the odontología. Dent, odonto, odontology is dentistry. Yeah, it's okay. It's dentistry. You can say dentistry, or you can say also odontologist. Right? Dentistry is another one. Super. Thank you very much. Let's continue. Let's continue. Okay, let me go to the YouTube as well. Here I have some other. Very good. Thank you very much, sir. Okay, let's continue now. Here we have. Let's continue with this. Now, I want you to continue working with me. Please, I want you to tell me something else related to the notes that you have. For example, how do you work with them? Well, let's do this a little bit at the end, okay? We're gonna see. Let's continue with this. So, there it is, the informed consent, el consentimiento informado, right? Just what you told me. And when we talk about it, It says here, I understand the risks and benefits of this procedure. So, what is that? The consent, the informed consent means that you agree with all the benefits and the possible risks that this procedure or treatment may have. For example, when you, as the person said, you require this consent in order to act, in order to start with the procedure, right? I give my consent for surgery. Yes, I understand the risks and benefits of this procedure, right? Another one is the prescription there, RX. Take 1 table twice daily after meals. Take one tablet, sorry, 1 table. Take 1 tablet twice daily after meals. Apply cream to the affected area once a day. What is a cream? Would be right, those cremas, right? Apply those creams to the affected area once a day. Common prescriptions, abbreviations, BID, TIP, PRN, STAT as well. Post-operative instructions. After a surgery, do not lift heavy objects for 2 weeks. Lift means alzar, cargar. Do not lift heavy objects for 2 weeks. Again, we can say keep the wound clean and dry. Keep the wound clean and dry. Return for follow-up in 7 days. What is follow-up? Seguimiento. Okay, revisión. Return for follow-up in 7 days. That is the post-operative instructions. And now I'm going to stop here. I would like you to start working with this. Please, can you write some other prescriptions or some other post-operative instructions, please? ¿Pueden colocar? Escriban en el chat, por favor, otras recetas que generalmente colocan o las instrucciones de postoperatorias. Coloquen, por favor. Pueden colocar para que podamos leer. Please do it in the chat, the Zoom chat, or maybe in the YouTube chat. Please do it, that I will be checking both of them. Do it, please, do it. Please, I will be waiting for your prescriptions. Estaré esperando por las recetas que colocan, please. Could be in English or in Spanish. There is no problem, okay? Could be in English or in Spanish. There is no problem. Do it, please. Do it. Okay. So, maybe another prescription could be, have a shot once a day. Una inyección una vez al día, right? Once a day or daily. Could be another prescription. Another prescription should be maybe take this tablet in case of pain. Tomar esta tableta en caso de dolor, right? Take 1 tablet in case of pain. Or take 1 tablet in case of 1 pill could be tablet or pill, okay, or pill. In case of temperature, right, or fever, better fever. In case of fever, in case of pain, right? Another one could be yeah, for example, do not wet the affected area, or do not wet the wound for 1 week. No mojar o humedecer, don't humid the place, el lugar afectado por una semana, let's say, right? Could be stay hydrated, very good, mantenerse hidratado, very good, Imelda. Stay hydrated, very good. Stay hydrated is another one. Stay hydrated. Then I have a question for you, that it is something that most of the time I heard, that is comer comida blanca y blanda. How can you say that? Well, actually, when we talk about it, there is one, maybe one knows. Eat plain food, very good. Eat plain food. That it is. Thank you very much. Thank you very much. That it is. Eat plain food. That is another one, you see. Thank you, Miss Imelda. What else? What else? What else? Do you have any other? Please just write that. Write in the chat. Write in the Zoom chat, please. I will be waiting for your participations. Okay? Continue, please. Continue. Write down if you want. If you know some others instructions, please write it down. Also, the informed consent. I give my consent for the therapy related to the cancer. I don't know. I'm just paraphrasing, right? Just telling some examples. But you know more than me with you in this area, so you may tell me. It could be in English or in Spanish. There is no problem. We will tell you anyway. Okay, please write down. Also here in the YouTube chat, please, you can write some post-operative instructions or prescriptions that you usually do. Okay, please write it down, please. Okay. This is very important, and we are gonna do this here. We're gonna work with you, okay? We have talked about all the related area to the health care, right? We talk about the vocabularies and prefixes, suffixes, body parts, some ways to talk to the patient, some ways to work in some areas, names of the professions, right? The specialists, subspecialists, doctors, nurses, on all the staffs. So, but now we're gonna concentrate a little bit with English, okay? Yes, we need to. Because this seminar is to know how to develop your language in a hospital from other countries in which English is the spoken language, or just maybe you have to talk to a patient who just knows English. Yeah, and I remember that happened to me, not because I wanted, because I was at the hospital. Yeah, the hospital, and there was a person who was there, and he knew he spoke just in English. And obviously, when he had to go to the doctor, nobody knows about him, because this person was the owner of a mine, and he didn't belong to Bolivia, but he belonged to one of this hospital, right? And he was there, and Jesus said, I no speak Spanish. And obviously, since I knew it, I decided to help him, even though I was a patient as well, and I had to translate everything. So that is the way it could happen. So maybe you would have some of those cases, right? So in that way, you have to talk about simple present, past simple, present perfect, and other ones. Okay. When you talk about the simple presents, you use the simple present, or present simple is the same, to talk about facts and general statements. What is facts, hechos, right? And general statements, right? Diagnóstico en general, right? Diagnóstico en general. So facts and general statements. For example, the patient has diabetes. Oh, the patient has diabetes. The patient has pneumonia, right? ¿Por qué estoy diciendo pneumonia, diabetes? Porque no tengo un acento en inglés que vaya en la última sílaba. No puede ir. Quizá algunas palabras porque tienen una descendencia o una raíz latina. Por eso puede ser. Pero el resto, que son nórdicos, no tienen una acentuación en la última sílaba, siempre en la penúltima o en la antepenúltima. Diabetes, pneumonia. You cannot say pneumonia, pneumonia, okay? Patient, right? So, and in that way, you can write any order. The patient has diabetes, pneumonia, arthritis, osteoarthritis, or lupus, and some others, right? Here I have some others, I think, include, here I have another one. Yeah, the patient result was altered. He was hyperglycemic. No, hyperglycemia, hyperglycemia, right? But you are saying él estaba con hiperglicemia, creo que es lo que quiere decir. So the patient results was altered. He was with hyperglycemia, with hyperglycemia, okay? With, no was hyperglycemia. Maybe you want to say was hyperglycemic, but I think that's not the way. He was with hyperglycemia, okay? That is the way, Romina. Thank you very much for your question. Let's continue. Any results, any disease must be with present simple, okay? Anyone, right? Él tiene soplo en el corazón, a heart blowing, right? Past simple. We use the past simple always for medical history, okay? The patient was admitted yesterday. The patient was admitted this morning. The patient had a terrible headache, or the patient had a terrible migraine. The patient had, I don't know, the patient was bleeding, right? In the medical history, you have to write everything in past. The patient was treated with this. The patient has The patient had his knee wound. His knee wounded. Okay, tenía la rodilla hinchada. I don't know. The patient presented some wounds in the I don't know, lateral area of the face, right? So or maybe the patient had and an object introduced in the hand, I don't know, or I don't know, in the forehead, resulting for a shot, I don't know, or maybe yeah, that could be. The patient was admitted yesterday with a gunshot in the abdominal area. Con una bala en el abdomen. That from this place to this place, I don't know. So everything has to be in past, because you are writing how was the person in the moment you saw him or her, right? You treated or you checked the person, right? That's why you need to use in simple past. Everything to write in simple past. Now it says there present perfect. Let's talk about the present perfect. What is the present perfect first? Because I need to tell you when to use the present perfect. The present perfect is a grammar structure that we use to show an action that started in the past, anytime in the past. We don't care about it, the specific time in the past, but in the past, started in the past. But this action continued until the present. It didn't finish yet, and it will finish until you decide. It could finish in the present or in the future. It will depend of the activity, or it will depend on the situation, right? But the present perfect talks about it. An activity, an action that started in the past, in any time in the past, but it continued until the present, and it could continue even in the future. Okay, so it's a non-ending activity. Es an endless activity. Es una acción que no terminó, sin fin. Se sigue realizando. That is the present perfect. Now, why am I telling you what the present perfect is? Because you need to use the present perfect to talk about the recent conditions that for the patient. For ongoing, it says that the situation that started in the past and continue here, or recent conditions, right? I have here some two examples. It says the patient has had fever for 3 days. That means that now he's still having the fever, but 2 days ago he started with the fever, and you're trying to control that, right? So the patient has had a fever for 3 days. Also, I have another one. The patient has had stomach ache since yesterday. Yeah, what does it mean? That he may have a very, very, very strong infection, right? So has had means that they still have the pain. Now, let's continue. There is something else that you need to use in English. I said for facts and general statement, the present simple. And what is the best verb that you may use? Has. The patient has diabetes, has pneumonia. Is with a case, also the simple present with the verb to be is or are. Better is because it's just one. The patient is with a strong case of diarrhea. I don't know, right? So has is the key verb in this case. The simple past of the verb to be was. was, were, if they are in plural. Yeah, the patients were admitted yesterday because all of them suffered I don't know, suffered a falling from the first floor of a building. I don't know, right? That it is. So was aware. But in the present perfect, we use also the verb to have. Obviously, in the past participle form, the patient has had, and it's correct to say has had. Ha tenido, right? Has had a fever for 3 days. Obviously, you can use also the verb to be. Has been with a. Has been with a. Also the verb to be. The past participle of the verb to be, ser o estar, is been, estado, right? The patient has been with fever for 3 days. Ha estado con fiebre por 3 días, right? Has been with a fever for 3 days. That it is, okay? But let's continue, if you have some other situations for present simple, past simple, or present perfect, please let me know. You may write down in the Meet chat so you can obviously let us know, okay? Pueden, en the Zoom chat, pueden colocar en el chat de Zoom para que ustedes puedan ayudarnos, obviamente, y colocar algo más si ustedes desean saber in Spanish or in English, okay? So I will be waiting for you. The same as in the YouTube, okay? Streaming. That it is. Let's continue. As I told you, present simple for facts and everyday activities or situations. Everyday activities or situations. Past simple for punctual actions in the past. Yes, I told you that they had, and when we use the simple past, we are talking about a punctual action in the past. We used to talk about a punctual action in the past. Yes or yes, okay? We use the present perfect to talk about actions that started in the past and continues in the present and even in the future. As I told you, those situations, okay? There are some others that also you may use in case of you have an advanced level of English. Could be passive voice. I mean, could be B2 or C1. If you have a B2 or C1 level in English, you know what I'm talking about, the passive voice and the modal verbs in recommendations. What is the passive voice? We use the passive voice when we want to talk about medical reports. What is the medical report? Un reporte médico, right? What is the passive voice? First, let's start talking about a passive voice. The passive voice is a structure that talks about an action in which the person is the subject is not so important. Yeah, it's a structure in which the subject is not the most important in the sentence. No, it's not. What is very important is the action, right? The action is the most important. In that way, in the common sentence, in the active voice, la oración común en inglés se llama oración activa. The most important is the subject because the subject performs the action. El sujeto realiza la acción en la voz activa, en la oración activa. Por eso es el más importante. Él come pizza. ¿Qué es lo que él hace? Él come, es lo más importante, él realiza la acción. He performs the action, he does the action. But in the passive voice, the subject doesn't do the action. En la voz pasiva o en la oración pasiva, el sujeto no realiza la acción. La acción cae sobre el sujeto. The action is the one that falls onto the subject, right? Falls into the subject. What does it mean? ¿Qué significa eso? That means that what is very important, what we emphasize in these sentences are the action, okay? The activities that you perform, okay? For example, the procedure was performed under general anesthesia. El procedimiento fue realizado bajo anestesia general, or under local anesthesia because it was not necessary to do it to work with general anesthesia. Okay, so, but it is passive voice. And another one is blood samples were collected and analyzed, right? Muestras de sangre fueron recolectadas y analizadas. But I told you about what is the passive voice, but what I have to tell you is how to work with the passive voice. So in the passive voice, what you need to think about is in the verb is the verb to be. Is, are, was, were. Specifically was, were. Why? Because you're talking about a past action, and in the passive voice, the key verb is the verb to be, because we always use the verb to be. Okay, and another verb in the participle form, right? So yes, in participle, yes. For example, let's analyze this little sentence. The procedure was performed under general anesthesia. So was is the verb that we always use in the passive voice. Was or were. Then comes the other word, the other verb performed, but always in past participle. Yes, siempre en pasado participio. In that way, en este sentido, was doesn't mean era o estaba. Ahora significa fue. The procedure was performed. Fue realizado. Fue realizada. Right? That's why we always use was. Siempre va a estar was or were ahí en la oración. Y el otro verbo es el que me va a decir qué tipo de acción he realizado. Was performed, was done, was injected, was collected, was, I don't know, any other verb, okay? And the way is that this verb must be in past participle, okay? The procedure was performed, the blood samples were collected, okay? And this is to talk about medical reports, okay, what you did in the SOAP, right? So let's continue with the modal verbs and recommendations. We have a lot of modal verbs. A lot of modal verbs. Can, will, could, would, must, should, ought to. But we don't use all the modal verbs because this is a specific way of telling the patient what to do. It's just a recommendation. It means you need to follow the orders. It's not a recommendation, right? First of all, the patient should take, debería tomar. That means that you are telling the patient in a strong way that that is what we have to do unless we have another opinion. Unless we have other opinions. The patient should take the medication with food. Right? Should take the medication with food. Debería tomar la medicación con alimentos. Right? But it's different if we use must, because should is a way to tell the person that what is what they have to do, but we don't force the person. Con el should le decimos qué es lo correcto que tiene que hacer, pero no vamos a obligar a la persona a hacerlo. You should take the medication with food. deberías tomar la medicación con alimentos, right? O los medicamentos con alimentos, right? But must is just forcing o blind. Con must yo estoy obligando al paciente. Le estoy prohibiendo al paciente o obligando al paciente a hacer algo o a no hacer algo. The patient must avoid alcohol. Paciente debe evitar el alcohol. I mean, there is no option. There is no other option to do that but to follow that order. In the first one, which should, you have to do the action unless you have a second opinion or unless something happened. I mean, there is a little option. But in the second, there is no option to do another thing that what you've been told to do. No hay otra cosa que hacer lo que te dijeron que hagas. That's why we need to use must, could, and also can. The patient can take the pills in case of pain. El paciente puede tomar las tabletas, maybe the pills in case of pain, okay? So that is something very important. So as a summary, you can use for modal verbs should, must, and can. Should when it's important to follow the orders, but it's not a must, no es una obligación. Must when you have to follow the orders, yes or yes, there's no other option. And can when you are able to do it, cuando puedes hacerlo, or maybe you may not, o no puedes hacerlo. You can take a pill in case of pain, maybe, I don't know, paracetamol, ibuprofen, I don't know, some of those, right? That it is, as I told you, for medical reports, actions falls on the subjects, the most important, but the action, right? Should, must, would, can, could. Is it possible to use would? Not at all. No puedo utilizar would. No mucho. Porque eso es una posibilidad. Maybe, in case of this, the patient would take the natural medicine as an alternative. Podría tomar medicina natural como alternativa. Yeah, he would take a tea. Puede tomar un mate, right? He would, podría, o tomaría un mate, would. Or could, right? The patient could take warm water. Podría tomar agua tibia or cold water. Could drink cold water. Podría o puede tomar agua fría. Yes, because then it doesn't happen anything if he does that action. Yeah, in those cases, obviously you can use can or could, or sorry, could and would, right? Because could and would talks about possibilities. Could and would, podría, y el ia del would, hablan de posibilidades. Posibilidades, they talk about possibilities. Possibilities to do something. Okay, avoid. Avoid is evitar. Yes, avoid is evitar. Okay, avoid is evitar. Thank you very much. I didn't check it. Sorry, Tali Garcia, sorry. Maria Martinez, sorry. Avoid is evitar. Avoid is evitar. So that is the way we may use this should, must, would, can, would. Okay. So we have some others. Yes, there are some other modal auxiliaries, but I think it's not necessary to use with this related with these words related to the healthcare area. Okay, so this is very, very important to know. Now, in that way, you can use the English language using verbally, in writing, right? And also, if you write, you have to read, right? So that is the way. So Now, I would like you to tell me some passive voice sentences. Okay? I mean, to talk about this, I would like you to tell me first some passive voice or maybe some modal verbs recommendations. Can you write in the chat? This is the last exercise. Hagamos este último ejercicio, por favor. Hagamos este último ejercicio tanto en el YouTube chat como en el Zoom chat. Escriban, por favor, escriban oraciones relacionadas con reportes médicos utilizando el passive voice. Y también recomendaciones en donde en las recetas médicas, ¿verdad? In the prescriptions, okay? Write what you do. If you don't want to do it in English, there is no problem. Do it in Spanish. Hágalo en español. ¿Por qué? Porque de esa manera vamos a poder hacer la traducción al inglés y así ayudarles a ustedes para que puedan tener mucho más vocabulario relacionado con el área de inglés en inglés, okay? Please do it. Do it. I will wait for you. I will wait a little bit for you so you can start working with it. Please write it down. Si está activado el chat, por favor. Please work on it, work on it. You can do it. Let's check it. Fabiana, por ejemplo, puede escribir algo. O Romina, José Aguirre, please. Or maybe Karen, Diana, Imelda, Daniela, Nancy, Noemi, Isabel, Rosillo, Elizabeth, Rosa, María, Tali García. Write something, write something. Please do it. Escriban, escriban. Escriban cómo podrían hacer una receta médica, cómo podrían dar la recomendación. Example, tomar ibuprofeno cada 8 horas, for example. How can you say that? Using modal verbs. Could, can, could, must, right? Should. Do it, do it, do it. Do it, please. Hello, hello. Hello, Clayder, Jimena. Hello. Do it, please. Write down, write down. I will wait for you. I will wait for you. One should be the patient must take, I don't know, must take, what is this? Ciprofloxacin 1 every 12 hours, for example, right? Could be. Very good, Imelda. Thank you very much. As you must take a pill every 6 hours. Very good. And how often do you normally, usually take pills? Tell the patient to take pills. For example, we can say, very good. The patient shouldn't eat 8 hours before his medical exams. Excellent, Romina. The patient shouldn't eat 8 hours before his medical exams, his medical testings, right? Very good. Excellent. Here I have another one. The patient should stay in bed for 3 days. Yeah, the patient should stay in bed for 3 days. Very good. Oh, thank you very much, Noemi. Thank you very much. Thank you very much. But yeah, I know that it would have been a very good idea, but now you have the chance to have it. Thank you very much, Noemi. So the patient should stay in bed for 3 or 2 hours. The medication should be taken 3 times a day as prescribed. Very good. The medication should be taken 3 times a day as prescribed. Very good. El paciente no debe tomar alcohol con medicamentos, es contraproducente. Very good, Miss Martínez. The patient must not, ahí debemos utilizar must, ¿verdad? Must not take pills with alcohol, yeah, with alcohol. The patient could take medication for fever each 12 hours. Very good, Katia. The medication should be prescribed. The medication should be taken 3 times a day as prescribed. You should rest as much as possible. Very good. You should rest as much as possible. Very good. That is great. El paciente debe aplicarse una dosis de insulina una sola vez al día. Okay. Yeah, the patient must apply one insulin doses. The patient must apply an insulin doses once a day. ¿Me lo puede decir? Yes, I already told you, Ms. Martinez. The patient must not take any medication with alcohol. Must not take any medication with alcohol. Very good. That it is. Oh, very good. Ciprofloxacin, 500 ml. Apply 1 vial every 24 hours. Ibuprofen, 600 milligrams, 1 every 6 hours. Very good, Isabel. Thank you very much. Thank you very much. Well, that is what I wanted you to do, to work with that. Yes? And that it is. Well, we have already finished with this seminar. I hope you like it, and I hope most important is not. I hope it was very useful for you. Okay, it had been very useful for you. Yes. Isabel, you can say takes ciprofloxacin 500 ml. Apply one every 1 vial. I mean, maybe 1 pill, 1 tablet, I don't know, every 24 hours, and ibuprofen 600 milligrams, 1 every 6 hours. It is okay. It is okay. It is okay, Isabel. Well, that is all for today. Es todo por el día de hoy. I am really happy for your participation, because that was the thing. That was the thing in this seminar, to make you participate in order to learn and to apply more what you know. Okay, so thank you very much. Thank you very much for your cooperation. Thank you very much for your that strong force that you have in order to learn the English language related to the healthcare area. Thank you very much, Isabel. Thank you very much. Y bueno, nos estaríamos viendo en otra oportunidad. Muchísimas gracias tengan todos ustedes, y que tengan una muy buena noche y resto de jornada. Gracias. Hasta luego. Thank you very much.